The Centers for Medicare and Medicaid Services, or CMS, recently released the changes for 2022 for the Remote Patient Monitoring Program. In this video, we'll talk about what those changes are and how they affect you. And we'll also give advice on how you can prepare for these changes in 2022. Hi, this is Dan from ThoroughCare. At ThoroughCare, we specialize in helping practices to manage programs like remote patient monitoring, and it's been a tradition here to share our feedback on how you and your organization can effectively prepare for upcoming changes to these programs. This year, CMS has lowered the reimbursement rate for remote patient monitoring. I know that sounds bad, but we do have some tips on how you can offset those lower reimbursements and still have a successful remote patient monitoring program. But first, let's look at those 2022 changes in detail. The Remote Patient Monitoring Program is based on several sets of codes. There's a time-based RPM code, where you have to get 20 minutes or 40 minutes or 60 minutes per month. There's also device-based codes, where you supply a patient a device and have a minimum number of readings per month. There's also a code for setup and education. Let's look at the time-based RPM codes first. In 2021, 99457 paid about $54 for 20 minutes of time. In 2022, 99457 will be slightly reduced to $52. This is a small drop, but it is something that our practices should be aware of. There's an add-on code for 20 additional minutes, 99458, that pays about $43. In 2022, this will be reduced to $40. Again, it's a small drop. 99458 can also be added for an additional 20 minutes at the same $43, but in 2022, it would be only $40. So at the 20-minute level, the reimbursement would be $52 compared to $54. At the 40 minutes, it would be $92 compared to $97. And at 60, $132 compared to $140 in 2021. Now let's look at the device-based RPM codes. 99454, which is supplying the patient with a device and having 16 days of readings per month, was $65. In 2022, this will be reduced to $56. Out of all the changes to 2022, unfortunately, this is the most significant drop out of all the care management programs. Finally, the code for RPM setup and education, 99453, was $21 and is slightly reduced by $1 to $20. So, how can we offset these lower reductions to still have a successful RPM program? First off, if you haven't done chronic care management or CCM, be sure to check out our other video on CCN. Even though RPM did lower its rate, CCM rates have increased significantly. For example, $42 is now $62 on a 20-minute reimbursement code. So using CCM for some of these codes is a great way to offset the lower RPM reduction. Finally, the supply device code is the one that dropped the most between 2021 and 2022. So one way to help offset this cost is to look for better cost-efficient alternatives for your devices that you use. We always recommend cellular devices and high-tech devices that can share readings instantly, but there's new technology coming out that allows you to use patient apps and portals. These apps can use the patient's existing smartphone or tablet, and you would simply purchase a license for them to take their vitals from home. This could be a cost-effective alternative to help you offset for some of that lower reimbursement rate. So what does this mean for your patients? Your patients can still get the peace of mind knowing that someone on your care team is monitoring their numbers. The RPM program is still very well liked by your patients, and it still pays over $100 per month for both of the primary RPM codes. If you spread that over a year, that's still $1,200 per year in reimbursements to the practice. The patients love it, so we would still encourage everyone not to give up on RPM. The reimbursements are still really good, even though they dropped slightly from the previous year. If you'd like to learn more about some of the RPM technology that I mentioned would be great for 2022, be sure to check out the links below and we'll be happy to provide that information to you. If you want to learn more about other CMS programs for 2022 and how those changes might affect your practice, be sure to check out our other videos in this series. And finally, there's a link in the description below that will take you to our Learning Center where you can read more about the new programs, and other things to be aware of in the coming year. If you'd like to learn more about care management software and how you can get some help, be sure to download our Buyer's Guide. It's free, and you'll get advice on how to manage these programs for your practice. If you have any questions, write them in the comments below, and don't forget to subscribe to our channel and like the video below if you found it helpful. That's it for now. This is Dan with ThoroughCare. Have a good day.